So what are the most common medications we give to someone on hospice or end of life? We give almost everybody something we call the comfort kit or the comfort pack. It has usually 7 or 8 medications in it, and they're all the same. They're not particular to that one patient. They're kind of given to everybody. This right here is the list. As you can see, there's a morphine, there's lorazepam, Levocin, Zofran, Tylenol, and bisacodyl. I will go over all of these. This is a 3-minute video, so if you're interested, stick with me. The most common one is morphine. People hear horror stories about this. We gave our loved one morphine and they died. Hospice just drugged up our loved one and then they died. This is why I'm here. I'm here to try to demystify what we're doing and why we're doing it. So number 1, not everyone on hospice will need morphine. Number 2, it has been clinically proven in 2 different clinical trials that morphine with hospice patients does not hasten death, meaning it does not quicken the process. Now, does morphine decrease the respirations? Yes. And that's why people think they're killing their loved ones. Morphine does decrease your need to breathe, right? Which sounds really scary, but we are not giving enough to send someone into a respiratory arrest, meaning they have so much morphine they quit breathing. We usually start at minuscule amounts, usually 5 milligrams, and it's for pain or for shortness of breath or something that we call air hunger, where the patient just feels like they can't get a good breath, but their oxygen level and everything is actually fine, but they just feel like they can't. That's a really bad feeling. So we will medicate with morphine. Morphine relaxes your diaphragm, relaxes your central nervous system, and just makes you feel like, The second thing we use is lorazepam or Ativan. That's for agitation or anxiety. Levocin is what we give to people with terminal secretions, which is called the death rattle. I have more videos about that if you're curious. It just helps dry up those secretions in the mouth. Zofran is for nausea and vomiting. All of these medications, by the way, are all absorbed sublingually in the mouth. This is the list again. So none of these pills have to be swallowed. The Tylenol and the bisacodyl are given rectally. The Tylenol is for end-of-life fevers and the bisacodyl is for constipation. And yes, even if your loved one hasn't been eating and they are unconscious, they still should be having bowel movements at least every 2 to 3 days. Another drug we give a lot that isn't mentioned on this list is Haldol. That's good for agitation or nausea and vomiting. Again, this is just a generality. If you have more questions, always ask your hospice team. Hope this helps.